Congolese officials say the new Ebola cases have been recorded in Bulape and Mweka health zones in Kasai Province. The first patient was a 34-year-old pregnant woman admitted to hospital last month with symptoms of fever and vomiting. She later died along with 14 others, including 4 health workers. Health authorities say 28 more suspected cases are being monitored. The DRC Health Ministry has called on the public to be vigilant.
Nous demandons donc que, au niveau du public,
we urge the public to report any suspected cases. We also ask that you desist from touching Ebola patients or the body of a person who has died of the disease because the contamination is direct.
Samples tested at the country's National Institute of Biomedical Research in the capital, Kinshasa, confirmed the Zaire strain of Ebola. Scientists say the virus is often transmitted from infected animals such as fruit bats and spreads rapidly through direct contact with infected people. The DRC Health Ministry is working with the World Health Organization and the Africa Centers for Disease Control to trace contacts and provide treatment. A national rapid response team has also been deployed to boost surveillance and containment in the affected areas. Chris Ochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
We're joined by Dr. Patrick Otim, Program Area Manager, Emergency Response of the World Health Organization Regional Office for Africa, based in Brazzaville, Republic of the Congo. Dr. Otim, thank you very much for joining us on Africa Live. Now, DRC declared a new outbreak of the deadly Ebola virus on Thursday. What do you make of this latest outbreak?
Thank you very much. Good morning and good afternoon to the viewers. Yes, as your colleague has rightly mentioned, we have this outbreak declared in the Kasai Province of DRC. It's not totally unusual because we know this is the second outbreak in the Kasai, the last one being in 2007, and also this is the 16th outbreak in the DRC. However, this is an outbreak that we are taking seriously, and we want to work with the government of the DRC to ensure that we can be able to interrupt this transmission as soon as possible.
How concerned are you with this latest outbreak, and is the government and its partners doing enough to make sure Ebola is eradicated completely?
Thank you. So the first part, it's this outbreak, we are taking it seriously because one, we are dealing with the Zaire species of the Ebola family. So the Zaire species is usually associated with a very high case fatality ratio that ranges between 20% to 80% of the people who are infected die. And it also is highly transmissible, so the risk of further spread is very high. And given the geography and the location where this outbreak is occurring, the movement of the population, the risk of spread is high. So with that, based on those three factors, we are taking this outbreak very seriously, and the government also is taking it very seriously, and we are working to interrupt it. Now, the second part of your question, Ebola is a zoonotic disease. That means that it starts in animals and then it spills over to humans. So it's not possible to totally eradicate, but what we've been doing is working towards elimination or mitigating the risk of transmission by vaccinating the healthcare workers, but also working across the One Health, so that the interaction between human and the animals, particularly those that are reservoirs for this particular type of virus, can be minimized. But it's not possible to totally eradicate it because the reservoirs are wild animals. And as long as we have that human-wildlife interaction, the risk for transmission remains.
Dr. Otim, what makes the DRC endemic to this deadly hemorrhagic virus?
So DRC is unfortunate to be by geography and by ecology. So but geographically where the DRC is located, we put it in what we call an ecological zone where the animals that are reservoirs for this particular virus are largely found. So we have thick equatorial rainforests where there are a lot of animals, there are fruit bats that are inhabiting this. And therefore, when you have human activities such as hunting, farming, and people moving into the habitats of these animals due to increased population, the chances of a spillover from the wild animals to the human population is very high. But this is not a risk that is only specific to DRC. So a number of the countries within the central and eastern part of Africa who fall within this ecological zone do have the same risk. And as you have seen in recent past, we've had similar outbreaks of filovirus in Tanzania and in Rwanda and in Uganda recently. It is all due to this same ecological zone which is shared by these countries, and where we have the animals that are the reservoirs of these viruses inhabiting, and therefore we will be having repeated outbreaks because of that risk which is inherent to this geography.
Oh, I thank you very much for those insights. Dr. Patrick Otim speaking to us there from Brazzaville. CGTN Sophia Shimechero takes a look at previous Ebola outbreaks in the DRC.
Ebola is back in the DRC for the 16th time, according to the country's health ministry. The first case of the virus was reported in 1976 in a village near the Ebola River, from which the disease takes its name, according to the World Health Organization. Overall, there were 280 deaths and 318 cases reported. Other major outbreaks include: in 1995, Kwilu Province's capital Kikwit recorded 254 deaths and 315 cases. A 2007 outbreak in Luebo and Mweke health zones in Kasai Province left 187 dead, while 264 cases were recorded. 2018 marked one of the country's deadliest outbreaks, which spread through North Kivu and Ituri provinces. The nearly 2-year-long epidemic killed more than 2,000 people, with over 3,000 reported cases. The last outbreak occurred in 2022, when only one case was confirmed in the eastern province of North Kivu. So what makes the DRC so susceptible to these outbreaks? According to the WHO, it is thought that fruit bats are natural Ebola virus hosts, and the dense tropical forests in the country are considered a natural habitat of the bat. Human exposure to this animal host is one form of transmission, while other infected humans or animals can also transmit the virus. The WHO also states that weak health systems, political instability, and lack of epidemiological surveillance have accelerated the rate of Ebola outbreaks in the country. Sophia Shimechero, CGTN.